Welcome to Rapid Relief Health. What's up, everyone? As a doctor of physical therapy, one of the most frequent and frustrating questions I hear from patients is, why do I keep waking up with a stiff neck or an aching back? You invest in a full night's rest, hoping to recharge, only to start your day feeling more banged up than when you went to bed. It's a cycle that can drain your energy and dampen your entire outlook. The culprit often isn't your activity during the day, but your inactivity at night, specifically the position you hold for hours on end while you sleep. Today, we're cutting through the noise and diving into the foundational principles of sleep posture. I'm going to share with you a practical spine-centric guide to arranging your body for truly restorative sleep. This isn't about buying the most expensive mattress on the market. It's about understanding the ergonomics of your own body and using simple, strategic support to wake up feeling refreshed, not wrecked. So, let's get to it. First and foremost, we need to establish our guiding principle. Tip number 1. The best sleep position is the one that supports a neutral spine. Before we talk about side or back sleeping, we have to understand the goal. Picture your spine from the side. It's not a straight rod. It has 3 natural, gentle curves. One in your neck, cervical lordosis, one in your mid-back, thoracic kyphosis, and one in your lower back, lumbar lordosis. These curves are designed to absorb shock and distribute weight. From the back, however, your spine should run in a straight line. The objective of a good sleep posture is to maintain these natural curves throughout the night, preventing any one joint, disc, or muscle from being excessively stretched, compressed, or twisted. Whether you're a side sleeper or a back sleeper, your mission is to create an alignment where your head, shoulders, hips, and heels could theoretically be connected by a gently curving straight line. This is what we mean by neutral spine, and it is the non-negotiable foundation for pain-free sleep. This leads us directly to tip number 2. Achieve neutral spine with the right support system, your mattress and pillow. You cannot maintain a healthy spinal position on a worn-out foundation. Mattresses have a lifespan, typically 8 to 10 years. Over time, they lose their supportive capacity and begin to sag, which forces your spine into unhealthy contortions. If you're consistently waking up sore, an aging mattress is a prime suspect. When it comes to your pillow, think of it not as a headrest, but as a neck rest. Its primary job is to fill the space between your neck and the mattress, keeping your cervical spine in a neutral position. A pillow that's too thick will jack your head up and strain your neck forward. A pillow that's too thin will let your head tilt back, creating similar strain. The ideal pillow is highly personal and depends on your sleep position and body size. I often recommend customizable pillows filled with shredded memory foam, as you can add or remove filling to achieve your perfect loft and support level. Investing in the right support isn't a luxury, it's essential maintenance for your musculoskeletal health. Now, let's apply these principles to the 3 common sleep positions, starting with the one I must caution against most strongly. Tip number 3. If you sleep on your stomach, it's time for an intervention. From an anatomical and biomechanical standpoint, stomach sleeping is the most challenging position for maintaining spinal health. To breathe, you must turn your head to one side, holding your neck in a severe, sustained rotation for hours, a direct recipe for neck strain, nerve irritation, and morning stiffness. Furthermore, with no support under the abdomen, the lower back often sags into the mattress, creating a painful, exaggerated arch that stresses the lumbar joints and muscles. This position also places unnecessary pressure on your internal organs and can restrict diaphragm movement. My professional advice is to make a concerted effort to train yourself out of this habit. The relief for your neck and back will be significant and almost immediate. For the many of you who are side sleepers, let's optimize your setup. Tip number 4. Master the side sleeping tripod of support. When you lie on your side, the goal is to keep your spine long and straight from your neck down to your tailbone. 3 key support points make this possible. The neck. Your pillow must be high enough to fill the gap between your ear and the outside of your shoulder, keeping your head in line with your spine. If your pillow is too thin, your head will drop down toward the mattress. If it's too thick, it will be pushed upward. This is where a customizable pillow shines. The torso. Because your shoulders and hips are wider than your waist, there's often a gap between your waist and the mattress. This can cause your midsection to sag down, side-bending your spine. Placing a small flat pillow or a rolled towel under your waist can provide crucial support here, maintaining that straight line. The knees and hips. Allowing your top knee to drop directly onto the bottom knee creates torque through the hip and pulls on the lower back. The simple, classic, and highly effective fix is a pillow between the knees. This aligns the hips, pelvis, and spine, relieving pressure on the joints and muscles. By addressing these 3 points, neck, waist, and knees, you create a stable, neutral tripod that allows your muscles to fully relax. Finally, for back sleepers, we focus on 2 zones. Tip number 5, optimize back sleeping with strategic support under your neck and knees. When lying on your back, your pillow should cradle your neck, supporting the natural curve without pushing your head too far forward or letting it fall back. Again, the loft is critical. The second major consideration is the position of your lower back. For many people, especially those with tight hip flexors, lying with legs straight can cause the pelvis to tilt forward, arching the lower back and creating tension. The solution is simple and profoundly effective. Place 1 or 2 pillows under your knees. This slight bend relaxes the hip flexors and allows the lumbar spine to settle gently into a neutral, supported position on the mattress, often alleviating that familiar morning ache. Remember, the path to pain-free mornings isn't found in a single magic bullet, but in the conscious, gentle support of your body's architecture through the night. Start by auditing your current position. Are you a stomach sleeper who needs to transition? Are you a side sleeper missing a knee pillow? Are you a back sleeper with a pillow that's throwing your neck out of alignment? Implement one change tonight. Your spine doesn't ask for much, just a little awareness and support. When you give it that, you're not just investing in better sleep, you're investing in a more mobile, comfortable, and energized tomorrow. If you found this guidance helpful, please share it with someone who might be tossing and turning in pain. Your body is designed to heal and restore itself during sleep. Let's make sure your posture is helping, not hindering that vital process. Thank you for prioritizing your health and wellness with Rapid Relief Health.